Hi.
I'm Allison.
I'm Drew.
I'm Taylor.
And I'm Sarah, and today we're going to talk about child, spousal, and elder abuse.
Welcome to the Education Station.
Choo-choo! Let's start with a scenario. In a minute, I'm going to have you hit the pause button and read through the scenario and the questions. Reflect on these questions. Make sure that you read the scenario and the questions carefully and answer them honestly. Now go ahead and pause that video and read the scenario. Welcome back. How was that? What did you think? Great. Now I want you to keep this scenario in the back of your mind throughout this video because we'll be revisiting it later. Now let's talk about some statistics. In North Carolina alone, according to the National Coalition Against Domestic Violence, 43.9% of North Carolina women and 19.3% of North Carolina men experience intimate partner physical violence, intimate partner sexual violence, and/or intimate partner stalking in their lifetimes. Also in North Carolina in 2013, more than 75% of the perpetrators of domestic violence-related homicides were male. Also, intimate partner violence accounts for 15% of all violent crime. Now, nationally, domestic abuse, we have more than 10 million Americans who are victims of physical violence annually. 20 people are victims of physical violence every minute in the United States, and 1 in 3 women and 1 in 4 men is a victim of some form of physical violence by an intimate partner during their lifetime. Let's talk a little bit about child abuse. Nationally, 1 in 15 children are exposed to intimate partner violence each year, and 90% of these children are witnesses to this violence. 1 in 3 children who witnessed domestic violence were also child abuse victims. Let's talk a little bit about elderly abuse. Nationally, every year, approximately 4 million older Americans are victims of physical, psychological, and/or other forms of abuse and neglect. Approximately 50% of older adults with dementia are mistreated or abused. 76.1% of physical abuse toward other older adults is perpetrated by a family member. Now I'm going to bring in Allison, who's going to talk about the signs and symptoms of abuse.
Now we're going to talk about some of the signs and symptoms of abuse, beginning with child abuse. Some of the immediate signs of child abuse that you may notice are broken bones, bruises, cuts, burns, and bites. It's important to be aware, though, that there are long-lasting signs of child abuse, such as anxiety, impaired socioeconomic skills, and delayed brain development. As PTAs, we also need to be aware that social isolation, neighborhood disadvantage, and a child being diagnosed with something that increases caregiver burden can have a greater risk factor on child abuse. Noticing these signs and symptoms does not always indicate abuse. However, children who are experiencing abuse at home may show these things. We also need to be aware that children who are experiencing abuse may have sudden changes in behavior or may be reluctant around a specific person or parent. They may express fear when it's time to go home or attach quickly to new adults, such as ourselves. We can also notice things in parents that could indicate abuse. Such things include denial of their child's problems or demanding a high level of performance on their child. Lack of supervision and lack of concern for their child can also lead to abuse. Parents of children who are being abused may ask you to be overly harsh when disciplining their child. Next, I'm going to talk about the signs and symptoms of spousal abuse that you see on the screen. Our patients who are experiencing domestic violence or abuse from an intimate partner may report to us about situations that they're experiencing. They may report that a partner has threatened them or forced them into unwanted actions or prevented them from desired actions. They may also confide in us that their partner has humiliated them publicly. Risk factors for spousal abuse can include jealousy, conflict fights, economic stress, and isolation. It's important to be aware of these as our patients may talk about them to us. Before moving on, let's look at elder abuse. Before we look at the physical signs and symptoms of elder abuse, we need to note that the elderly population may be too ashamed to report mistreatment. The elderly population is often dependent on caregivers who can neglect them. We need to be aware of the situation or the overall situation of our patients because we need to pick up on things that they may not tell us. We should notice when they withdraw from activities that they're usually engaged in or when they're confused or agitated. These are all common after abuse. In addition, we should look for physical signs such as bed sores and persistent pain, and being aware of unexplained situations such as unexplained bruises or scars or unexplained weight loss. These can be indicators of abuse as well. It's important to be aware of the signs and symptoms of abuse and understand things that our patients may report to us so that we can report it to the proper authorities. Taylor is going to come and talk about documentation in regards to abuse.
Moving on to the medical records side of abuse. It is so imperative to document everything when it comes to health care with accuracy and detail. As we know by now, if it's not documented, then it didn't happen. There are several different types of abuse that are most commonly seen when it comes to treating patients. Abuse can be shown through neglect, for example, letting a patient lay in bed in the same position all day in the hospital bed. Sexual abuse, when someone is taken advantage of in a sexual manner. Emotional or psychological abuse is also seen in healthcare. Examples of emotional abuse include, but are not limited to, bullying, gaslighting, and false accusations. As soon as you see or have any suspicions that abuse is occurring, it needs to be reported. Not doing so can be considered a crime. Now, there are some things that you need to be aware of in the documenting process. You want to make sure the suspect and victim are interviewed separately to avoid a hostile environment so accurate information can be obtained. Once both parties have been interviewed, make sure you note any inconsistencies between the two stories to sway your accusation. If any physical findings such as bruising or cuts are visible, be sure to take pictures or draw illustrations to back up your case. While you are recording information, it is important that all of your information state facts and leaving out any personal opinions or judgment towards either party. Including opinions could lead the authorities to believe you're showing a favor to one side through pity or sorrow. Make sure to note any evasive answers to any questions you ask. Note delays in treatment or medical attention sought at other facilities, as suspects may look to avoid any further questions from you. Try to include the persons responsible for caring for the victim, as this could be vital to your documentation. Direct and concise quotes always provide good evidence because you get your point across without any questions. Record the name of your facility as well as the departments included with the incident, such as the PA or OT. Outside departments are also important to include, such as law enforcement and welfare agencies. Any support or teaching provided to either parties should also be recorded. And remember to always follow up on your report. You don't want all of your documentation and investigation to be for nothing. Be sure to do all you can to bring justice to the situation as a healthcare professional. Now, Sarah is going to be talking about state and federal regulations regarding abuse.
Okay, so we're going to be talking about state and federal regulations regarding abuse. According to the APTA, physical therapist assistants shall report suspected case of abuse involving children or vulnerable adults to the appropriate authority subject to law. In the United States, we have federal mandated reporters, which are people that are required by law to report any suspect of abuse for children or dependent adults or the elderly. These people are social services, law enforcement, education, direct caregivers, licensed health and human service professionals, employment in if you're employed in a licensed facility, or a medical examiner or coroner activities. Okay, in North Carolina, a private person generally has no obligation to report evidence of a crime. There may be strong practical and moral reasons to report a crime, but that's not the same as a legal duty. However, as a North Carolina citizen, in certain situations, you do have a legal duty to report. These situations are if child abuse and/or neglect by a parent, guardian, or custodian or caretaker is suspected, abuse, neglect, or exploitation of a disabled or elder adult by their caretaker. And physicians and hospitals must report to law enforcement certain kinds of wounds, injuries, or illnesses. Okay, to whom should reports be made? Reports should be made to the director of the County Department of Social Services in the county in which the child or disabled adult resides or is found. Reports may be made orally or in writing. Incidents should be reported by the physician or surgeon treating the case, or if such a case is treated in a hospital, sanitarium, or other medical institution or facility, or physical therapy clinic, by the director, administrator, or other person designated by the director or administrator to local law enforcement where the place of treatment is located. Okay, when must you report? In North Carolina, it's required to report when you have any cause to suspect abuse. The standard is lower than the usual reasonable suspicion standard, which means if you have any cause to suspect that there's abuse happening, you must report it. Anytime that you have any cause to even suspect abuse, it's imperative that you report it, and there's no specific time to make the report, but as soon as possible is the safest course of action. Okay, so for the previous slides, all of those state and federal regulations were pertaining specifically to child and dependent adult abuse. Continuing with the elder abuse, we have certain people working with that population called ombudsmen. They serve as advocates for residents in nursing homes and adult care homes throughout North Carolina. They receive and investigate complaints made by or on behalf of long-term care residents and work for their resolution. It's not a regulatory agency, it's more of an advocacy program. So the ombudsman do not investigate allegations of abuse, neglect, or exploitation. However, their role is to refer any necessary information pertaining to an allegation of abuse or neglect to the local authority, to the local county Department of Social Services Adult Protective Services Unit. Oh, God. Okay, our role as healthcare providers is a little bit different when it comes to domestic violence. There are separate obligations to report certain injuries to law enforcement, including firearm injuries, poisonings, wound caused by knives or other sharp instruments if a criminal act was involved, and grave bodily harm or grave illness if it appears that the injury resulted from a criminal act of violence. It's mandatory that as a healthcare provider, that these things are reported as abuse. However, during the visit, when it comes to domestic violence, a lot of times the type of disclosure that we normally will get pertaining to coercive behaviors would be more along the lines of emotional abuse, tactics used by a batterer to maintain power and control in a relationship, and reproductive and sexual coercion. And these behaviors and reports do not fall under the legal definitions of mandatory reporting statutes federally and in North Carolina. Therefore, there is no need to be reported to law enforcement. However, it's important that we follow the documentation that Taylor discussed earlier. Okay, here we've just included some resources for abuse. We have the National Domestic Hotline, which advocates and is available 24/7. It's important that we know about these and other resources that are available through our clinics or through the hospitals if we come across any person that falls under the categories of abuse. For us as student physical therapist assistants, it's important that we continue our education through continuing education. And there are several courses that you can take in recognizing and providing care for child abuse, elder abuse, and anything that falls under that. Okay, now let's revisit the scenario. Is there anything that you think you would do different? In just a second, I'm going to ask you to hit pause and reread the scenario and go back over those questions and see what you would do different. Okay. Okay. Wait.
We hope you learned something and feel more prepared for these situations.
Thanks for chatting with us.
Thanks for joining us at the Education Station.
See you next time.
Bye.